Go.
Priscilla Hopkins.
Hi, Karen.
Yes, hi.
I see here you're about 75 years old and you went to your doctor after you had an episode of coughing blood. They saw a possible lesion in the right lower lobe, and then you underwent a chest CT that confirmed an approximately 4-centimeter mass. You were then referred to your pulmonologist, and he referred you, and he performed an endobronchial ultrasound back in March, with that pathology showing a lung cancer, specifically non-small cell lung cancer adenocarcinoma, which is the most common subtype.
Yeah, that's right. And then he sent me for a PET and a CT.
Yes, I see that. It showed metabolic uptake consistent with the cancer in that lesion in the lower right lobe. But the images showed no suggestion of any lymph node involvement or distant spread of the cancer. After that, you had your surgery in early April. How did that go?
Actually, better than I was expecting. I really liked that minimally invasive procedure. I just hardly had any pain afterwards, and I was able to be discharged in just a couple of days. And I really haven't needed any pain medication after that.
That's great. And you've been doing well since then?
Well, yeah, I was back eating pretty well and breathing normally with my regular activities within a couple of days of getting home. I'm really feeling back to normal at this point. And I think I have been for a couple of weeks.
Overall, this means that you have what I would estimate to be an approximately 70 to 75% chance of being cured of your cancer without any further treatment.
Ooh.
The question we need to consider is whether any further treatment would significantly reduce that risk and whether it is worth pursuing it.
Oh, but I've had several friends that have had chemotherapy and have had a difficult time. I'm concerned about my heart disease and history of kidney problems, which makes me wonder whether I could really tolerate chemotherapy very well.
You certainly have fair concerns. The key is that the chemotherapy is very helpful for a small minority of patients, but we can't identify which patients are going to be the ones who would benefit most.
That doesn't sound especially promising to me. Would my risk be higher because of my age and other medical problems?
Yes, you bring up a good point. You're about 10 years older than the majority of the patients on the trials that proved a benefit from postoperative chemotherapy. And with your other medical problems, that likely means that your risk of problems from chemotherapy are a little greater than those in a so-called average patient, if there is such a thing.
Can I talk about it with my family?
I definitely recommend that. Let's meet later this week to discuss your thoughts then. Hi, Karen. Good to see you again. I've got the results of your CT scan, and unfortunately, there's some new enlargement of lymph nodes in your mid-chest, and there are some spots in your liver that weren't there on the last scan. We'll need to do a biopsy to confirm it, but I'm concerned that this looks very much like the cancer has returned and spread.
I knew something wasn't right. My energy has been way down, and I would sleep all day if my husband would let me. I also lost about 5 pounds. I just don't have my usual appetite, but I really want to discuss whether I should get treatment or not. I'm still concerned about the side effects. I don't want to feel sick all the time, but if I could treat cancer with minimal side effects, I'd be interested in.
Okay, assuming we confirm after a biopsy that it's the same cancer you had 2 years ago, there are definitely options. At this point, the cancer would be curable, but at this point, the cancer wouldn't be curable, but it's definitely treatable. The goal would be to have a little longer, commonly several months, but sometimes even years.
And how much would this help me? Might I live just a couple of months longer?
Some patients get a much greater benefit, possibly over a year or even a couple of years. Others get the more average few months, and others don't benefit at all. Similarly, some have a very easy time, some have relatively minor side effects we can manage pretty well, and some have a much harder time than we'd have hoped and expected. It's important for you to know that we can always adjust the plan or stop treatment if it's not acceptable to you. I'd plan to follow you closely for side effects during treatment and then repeat a scan after about 6 weeks of treatment to see how your cancer is responding. We can then decide whether it's helping enough when weighed against the side effects.
Well, that sounds good. Can I bring my husband in to discuss the details, and can we bring him to the next visit?
Sure. We need to meet again after the biopsy and would want to review the results of the molecular marker testing anyway. I want you to be as informed as you can be before we start treatment.
Thank you.